It's Dr. Jason Lichten from Central Ohio Plastic Surgery. A question I always get is, what's the difference between a breast reduction and a breast lift? When you do a breast reduction, you're going to lift the skin, and when you do a lift, are you going to take some away? And so the answer is, realistically, a breast reduction and a breast lift have a very similar technique and use basically the same incisions, the same approaches. It just depends on how much you're taking out. Most of the time, if we're taking out more than a pound of skin and breast tissue, we'll call that a breast reduction. If it's less, if it's just I need to lift things up a little bit, we will take a little bit of skin out, a little bit of breast tissue potentially, especially if it hangs off to the side, that heavy lower portion of the breast, but that still can get classified as a breast lift. Realistically, what does it matter what we call it? The answer is sometimes if we're talking about the idea of, is this going to be something I pay for out of pocket as a cosmetic surgery, or is it something that my insurance may potentially pay for? Insurance companies don't pay for breast lifts unless they're associated with breast cancer, but for most patients, a breast lift is not going to be covered by insurance. So why not call everything a breast reduction? Well, it's not truly legitimate to call something, if you're taking off 1/10 of a pound of skin or just lifting things up a little bit, a reduction. Insurance company isn't going to cover it. Usually it's talking about ways to make sure you hit their criteria. So when we talk about a breast reduction, that is something we're doing for medical reasons. Significant back, neck, shoulder pains, things that interfere with daily activities, things that cause rashes underneath the breast that require trips to chiropractor, physical therapy. Other medical practitioners have to use topical creams or lotions or ointments or prescription medications for the pain or for the rashes. If those things don't exist, even if you are taking out more volume, that typically is going to be something that's going to be paid for out of pocket. In terms of insurance requirements, you should check your particular plan, your particular insurer's requirements for what you need to have documented in order to have them potentially cover a reduction. But a reduction isn't going to necessarily be the same aesthetic result depending on where you want to be. Sometimes patients feel like they're smaller after a reduction than they would want to end up being. So we'll balance that out, balance out what your goals are, and try to match those by deciding what the right procedure, right approach, and right payer source would be for your surgery. For instance, this and more questions, go to the website at ohioplastic.com or call us in the office at 740-653-5064.